First of all, let me say thank you, everyone who's on the call. And sorry for the bit of hesitation, but I do believe that it'll be well worth your wait. And here again, we are here. I'm not sure if Senator Hicks Hudson is on the call because I'm limited to my phone, but I think it's important for us to recognize that we are co-chairs. And as co-chairs of the Black Maternal Health Caucus, we are here as conveners and trying to make sure that we are getting information out that would help us make decisions here at the State House in regard to Black maternal health and infant mortality and all those things that are connected in a set way that comes from our hearing how the providers are working and the work that they are doing and how that should impact legislation that we should be fighting for, putting through and making sure is impacting the folks that need to have this help done. So I'm going to turn it over to my aide, Deja, and Deja, of course, will introduce our guest for today because I want to get straight to their information so that we can have time for questions that I'm certain you will have. So thank you again for being here. Hicks Hudson, is she there or is there a
She's
there?
Still in her committee right now, so she'll be joining probably in a little bit.
Fabulous. When she gets from committee, we'll see, and then she'll be able to have comments also. Okay, thank you.
Thank you so much, Senator Ingram. I'm Deja, and today we are welcoming the Health Policy Institute of Ohio. We're going to be talking about their brief that is unlocking the economic potential. So looking at some ways that we can, there's opportunities, for money to be better allocated if certain things that they're going to be focusing on may be addressed, whether it's, through the legislative process and so forth. So again, I am excited to have the Health Policy Institute here today to present their findings. It's very important information. And then as a side note and just disclaimer for everyone, if you have questions, we are in a webinar style. So if you're in the audience, you can't necessarily speak during the meeting, but you have the option to participate through the Q&A. So if you just click on the Q&A, it should be, if you're on the phone, it's like at the top. If you're on the laptop, it should be maybe at the bottom. You can click that, put your comment, question, concern in there, and we're able to see that, and we will get to it, at the end of the meeting. So Carrie, if you would like to begin, you're more than welcome to. Thank you.
Thank you so much. Thank you so much, senators, for having us. Thank you so much, Deja, for the introduction. I'm going to pass it over to Amy, our president and CEO, to kick us off.
Thank you, Carrie. I'm Amy Rowley-McGee. I'm the president of the Health Policy Institute of Ohio. And again, thank you to the senator and to Deja for arranging for us to present today. Carrie, would you mind flipping the slides? That would be fabulous. Thank you. The mission of the Health Policy Institute of Ohio is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending here in Ohio. We are a nonprofit organization based in Columbus. We are both independent of any particular sector in the health world, and we're a nonpartisan organization. Next slide, please. We are funded primarily by foundations across the state. In fact, we were created by some of these foundations over 20 years ago. Those foundations came together because they believed that there was a need for a nonpartisan and independent source of health policy analysis. We're thrilled that they continue to fund our work and others have joined along with them. Next slide. You're going to hear a lot of the data that HPIO compiles and analyzes for the purpose of informing policy decisions today, our goal is to put data into context. So we do that by comparing Ohio to other states and also analyzing how Ohio is performing over time to know whether we're moving in the right direction or not. We also elevate concise key findings. An example of our work is our health value dashboard. That has over 100 metrics in it. That can be rather overwhelming to absorb. So we do that legwork by looking at the data and extracting some key findings that are relevant to policymakers today. And then we also importantly highlight what works. While we have much room for improvement here in Ohio on health, on equity, and on healthcare spending, the good news is that there are evidence-informed strategies and policies that we could either more fully implement or deploy here in our state to improve. Next slide. All right, is this where you take over,
This
Carrie?
is where I'm taking over.
All
Thanks,
right,
Amy.
great.
Thanks again, everyone, for joining on today. My name is Carrie Almasy, and I'm the Director of Assessment and Planning at HPIO. Before I get started on the analysis that we mentioned earlier, I'm going to share a little bit of context on why the Health Policy Institute of Ohio released a report on economic potential and what the tie-in is there. So many of you are familiar with the fact that in Ohio, Black mothers are nearly 2 times as likely to suffer from severe maternal morbidity, which is a severe complication that arises during labor or delivery, than white mothers. Black mothers are also more than 2 times as likely to die from a pregnancy-related cause than white mothers in our state. The slide you see here shows the leading causes of maternal and infant mortality. But we consider these to be tip of the iceberg issues that point to underlying challenges in our social, economic, and physical environments. Racial disparities in issues like maternal morbidity and mortality persist because there are longstanding inequities in those social, economic, and physical environments. On my screen, there's an example of one of those underlying factors, or what we call social drivers of health. It shows that severe housing cost burden is 2.2 times higher for Black Ohioans than for white Ohioans. So we all know that when you're spending more than 50% of your income each month on rent, you have few resources left to pay for everything that you need to be healthy, for things like healthcare and healthy foods that can sustain you throughout your life, throughout your pregnancies, and beyond. But it's important to note that these social drivers, like access to affordable housing, don't just impact health. They also impact our state and local economies. So that's why we are so excited to share the findings from our latest analysis with you. Our hope is that this analysis will give you new data to take back to your communities to build the case for implementing evidence-informed solutions to achieve equity in our state. So what did we measure? For this analysis, we worked with a nonprofit research firm called Altarum. First, we measured current racial disparities in income, health outcomes, and incarceration in Ohio. Then we estimated the immediate economic impact of eliminating those disparities, as if we were to wave a magic wand and make them all go away immediately. Then we looked out into the future to estimate how Ohio's changing demographics would impact this equation over time. To do that, we estimated what the population of Ohio will look like in 2050 and what it would mean to eliminate disparities for that population. I'll go over those changing demographics in more detail later. But first, I want to start by sharing what we found overall. We found that if we were to eliminate disparities by 2050, Ohio could gain almost $80 billion in economic output each year, along with all the benefits you see here, including things like increased state and local tax revenues, reduced healthcare spending, reduced correction spending, and many more. So if you're like me and have a hard time wrapping $80 billion around your brain and understanding exactly what that means, to put that in context, that's 10% of Ohio's current economic output. $80 billion is more than 40% of the state biennial budget that we just passed. Globally, to put that in context, that's more than the GDP of 2/3 of countries in the world. We're talking about a huge amount of money that we'd potentially be able to bring into the state. So first, before I go deeper into what we found in the analysis, I want to quickly recap the underlying drivers of disparities that we went through in the analysis. So for anyone who has seen us present before, you've probably seen this pie chart right here. It might just be HPIO's favorite graphic of all time. It shows that the majority of the modifiable factors that influence our health come from our community conditions, including things like the availability of employment and education opportunities. So things that we always say that clinical care is incredibly important to our health overall, but that access to care in and of itself is not enough to ensure a healthy population. That we also need to focus on that social, economic, and physical environment. You can also see that underlying all of this are drivers of inequities, such as racism. Racism unfairly and unequally distributes resources, power, and opportunity, resulting in disparities. It shows up in many ways in our society and influences people's ability to access the resources and environments they need to be healthy and financially stable. One example is current and historic housing discrimination, which has suppressed Black home ownership and limited opportunities to build generational wealth. Because racism has been built into systems like housing, over time, these systems produce unequal outcomes without the participation of people who hold individual racist beliefs. It's not about only racism on an individual level. We are seeing that structural racism is contributing to the inequitable social drivers of health, which then leads to poor health outcomes and reduced financial prosperity over time. Because of all of these connections I just shared, people with higher incomes tend to live longer and healthier lives than people with lower incomes. In Ohio, barriers to employment and wage growth experienced by Black, Hispanic, and Latino people result in incomes that are less than 2/3 the incomes of white Ohioans on average. But if we were to eliminate this disparity in income, we would be able to grow our state's overall income, increase economic output, increase spending on goods and services, and increase state and local tax revenues. This slide shows how the impacts of eliminating disparities in income would grow over time. So what you see on my screen, we would gain this much money each year in Ohio by 2050. Many of the factors that contribute to disparities in income also contribute to disparities in health outcomes, such as limited access to employment opportunities, transportation, and health insurance. Ohioans of color are more likely to face these barriers to good health and experience related disparities. So on my screen, I show that Black Ohioans are 1.3 times and Hispanic Ohioans are 1.2 times more likely to report fair or poor overall health than white Ohioans. If we were to eliminate these health disparities, we could reduce healthcare spending and increase employee health and productivity. And this is how these figures would grow by 2050. We could reduce $3 billion in healthcare spending in our state. But eliminating disparities in health would also greatly reduce premature death in our state. So as you see here, white Americans have average life expectancies that are almost 6 years greater than those of Black Americans. We see a similar trend here in Ohio, where Black Ohioans are collectively losing thousands of years of life due to premature death before the age of 75. When we're talking about years of life lost, we're really talking about babies unable to make it to their first birthdays, working age adults who pass away before they can enjoy retirement, and older adults who are unable to spend their retirement and their last years with their families. But if we were to eliminate those health disparities in Ohio, we could prevent premature death that results in 135,000 years of life lost among Ohioans of color each year. And that's valued in economic terms at $14 billion. Poor economic conditions, unemployment, and low educational attainment can also lead to criminal justice involvement. Ohioans of color are more likely to be to experience these conditions and also to be negatively affected by unjust biases, policies, and structures in the criminal justice system. This results in stark disparities, including that Black Ohioans are incarcerated at 6 times the rate of white Ohioans. If we were to eliminate these disparities, 40% fewer Ohioans would be incarcerated, and we could save millions each year in correction spending. Again, we would see the impacts of eliminating disparities in incarceration grow over time. And I'm going to go into a little bit of detail on why that is. So we know that Ohio's racial and ethnic diversity has always been a source of cultural, social, and civic prosperity in our state. Today, communities of color are the key driver of our population growth. Between 2010 and 2020, all of our growth in Ohio occurred among Ohioans of color. As our population continues to become more diverse over time, the benefits of eliminating racial disparities will become even more significant. There is room and opportunity for all Ohioans to take meaningful steps to dismantle systemic racism and improve the health and economic vitality of our state. It's also important to note that what we're talking about isn't an all or nothing equation, but that we can realize some of these gains as we make progress towards eliminating disparities in our state over time. So if you know anything about HPIO, as Amy mentioned, we love to provide an evidence-informed recommendation for action. So we prioritized 6 recommended action steps and provided examples of state and local governments who have implemented them. These include things like 1, implementing and assessing policies and programs that promote justice and fairness, such as Meigs County's health equity policy. Also tailoring policies and practices to support Ohioans of color, with a good example being Toledo's Racial Equity and Inclusion Council. Another example would be allocating funding and resources to support policies that strengthen Ohio's communities, with an example being Franklin County and the City of Columbus's Housing Action Fund. We also recommended increasing accountability for eliminating disparities in outcomes, such as through the Ohio Equity Initiative Evaluation Project, implementing criminal justice policies that provide accountability and address the underlying drivers of crime, including the Deferred Prosecution Program in Montgomery County. And finally, increasing equitable access to financing, support, and business resources for Ohioans of color, such as through the Minority Business Enterprise Program. Now, I should also mention that there are a number of other evidence-informed policies that the state could implement that could reduce disparities and inequities in the social drivers of health that we mentioned. We would be more than happy to provide examples of what those could look like, should anyone have questions there. But I want to close by sharing that these 3 key findings and driving home that we can increase the health and economic vitality of our state by eliminating the disparities experienced by Black and Latino Ohioans. And if we fail to act, we stand to continue losing billions of dollars each year. But we need participation from leaders like you and people in both the public and private sectors to drive meaningful change in our state. So we would love to open it up to questions.
Carrie, I just want to say, this is Deja, Senator Ingram's senior legislative aide. I'm just hopping on to say thank you so much for that presentation. I know that was a lot of information, a lot of
Yes.
overview, and then a lot of detail. So I definitely want to encourage everyone in the audience. I mean, we have legislators in the audience, we have community members in the audience, constituents, to utilize the Q&A. Again, it's at the top of your screen if you're on your phone. I think the bottom if you're on a computer. You can feel free to put your questions in there. We do have 2 questions, and I can go ahead and read those and, you know, leave them for the panelists and our legislator panel, Senator Ingram, Senator Hicks Hudson, to, you know, offer a response to that. So I will read that here. So our first question that we have, which I think is really important to know, you know.
We can't hear you anymore.
Can you hear me now?
Yes.
Sorry, I think I covered my mic. So one of the questions is from Dorian, and I think it's important because it says, you know, a lot of this information isn't new. And, you know, these are things that we know about and we talk about a lot of the time. And as you're presenting these, you know, solutions to the issue, I think that's important to note. And so they say, you know, as none of this is new information, is it now intended to persuade policymakers to not exercise their internal racism in an effort to remove these disparities? And if so, what is it that we should expect to see in the next General Assembly? So Senator Ingram or Senator Hicks Hudson, or even other legislators, you know, you can put your comment, I guess, in the Q&A if you're not able, obviously, to speak. So
I apologize. What was the final question?
essentially, Dorian, you know, saying that this information is not new,
Right.
and that, you know, moving forward though, and like we're having these conversations, what is it that we should expect to see in the next General Assembly or even in the current one, you know, as we're, you know, bringing up this information and, you know, revisiting it and hearing these kind of recommendations to the issue.
Well, you look at, let's just take the last budget. There are lots of dollars in the budget to do lots of things. And our responsibility, in my mind, as a legislator, is to make sure that when we are evaluating what those dollars have done, because as he noted, this isn't a new issue. We've known that there's been the disparities. I think the COVID exacerbated those issues that already existed. But what we have to do is at some point start holding folks accountable to how we ever get to, if indeed by the year 2030, there should be, you know, equity in housing, et cetera. How do we hold folks accountable since there are dollars that are out there? And therein, which is what much more difficult, because we don't all agree on who should get those dollars, where those dollars should be spent. And until I believe that the entire legislature understands how hard we are being hit by these continued disparities, I don't think that some folks are going to make decisions about how to spend the dollars, how they should impact, and what legislation should be there, because it's kind of like, well, not in my backyard, so I don't have to worry about it. I don't have that many African-American constituents, so I don't have to worry. The reality is it impacts all of us, whether you have a large group of an urban, if you're in Cincinnati, or if you're in Toledo, if you're in Columbus or not. Those housing issues still impact you, and we should be addressing them all and not in little pockets, which unfortunately is what we have done, what we continue to do. So we need to, as legislators, be able to require that there be a housing project like the one in in Columbus if there's a housing fund. You require that, or you can target where there's the biggest disparities and require that those facilities, but nobody wants to do that.
Yeah, I'm going to take another view of it. I agree with what Senator Ingram has said, because I do think it's important that we try at every opportunity to raise those issues up with our colleagues. I'm going to take another tactic, because I think before we look at the next GA or the additional things which are important, that I intend to focus on what was passed in the budget and see about the implementation, and to kind of bird dog those implementations, because there are some things in the budget that, if we can make sure that the departments are doing what they're supposed to do, can hopefully move this forward. And then for me, within another issue that I'm looking at is about the environmental impact upon communities of color, and how that also affects the healthy outcomes of families and babies and things like that, which is something that I'm learning about each and every time I go to conference that may not necessarily be within this realm of health, but it is within the realm of the environment. And so, to answer that question, I think, we've got to do two things: bird dog what's already been passed to make sure that is implemented, and to ask those tough questions with that lens of our communities that we do represent within the urban core.
Senators, would it be okay if I responded as well?
Yeah.
Okay, great. Well, yeah, 100% agree with what both senators have said. I will also just add to that while this information is not new to those of us who have been in the field a while, in the legislature a while, there are continually new legislators coming to the General Assembly. So establishing a foundation of knowledge on which to create policy is very important. And the pie chart that Carrie shared earlier, that is often, regardless of what audience we're speaking to, legislators or like regular people out in the world or providers, this is often surprising to people. Many of us think about clinical care when we think of health. And while that is critically important, if you're sick, if you're having a baby, it's not the only contributor to our overall health. So for those of us who, have a roof over our heads, have access to healthy food, are making a decent income, we often forget that those are all contributors to our health, and that not all Ohioans have that. So I think just continually educating folks about the contributors to health, and talking about how those either inhibit or support healthy behaviors and healthy choices is something that we just need to keep doing over and over again. I just spoke to a group a little while ago of neomed students, and these are folks who are going into the health profession, and they said, well, we have all of these great hospitals, gleaming buildings, beautiful places to get health care, and we do. Ohio is a great place if you're sick, but it's not a great place to be well. And that's for all the reasons that Carrie described. I'll also just add that the economic analysis that we focused on today is new. So much of HPIO's work has focused on the health impact of racism and discrimination. This builds upon that work to elevate the economic impact, which is also an important consideration if we want to move to health, well-being, and economic vitality here in our state. And also we have done previous work, we have previous publications that touch on action steps that we can all engage in to address all of those levels of racism that Carrie spoke to earlier. So while the economic impact analysis is largely focused on structural racism and the impact of structural racism, there are important actions that policymakers and others can take to address individual level racism as well. Do we move on to that next question?
Yeah, thank you so much. I think that was a wonderful way from all the folks who spoke to that. We all appreciate your response to that. And then the other question that I have, well, on a side note, is where can we access this presentation? So I don't know if y'all are able to send it
Sure.
to me, and then I can, perfect, and I can distribute it to everyone that was on the call and share that with everyone. And
We're
then
also going to put a link to the brief that we presented on today in the chat for you.
perfect. And then our next question that I see is from Kaylee, and it says that the question is, are there any programs that would be affected by a government shutdown that would have a negative impact on maternal and infant mortality? So I think maybe that's referring maybe more, I don't know, to like the federal level of a government shutdown.
It is.
Yeah.
Yeah.
But it is referring to the federal level, but remember, some of our programs do get those federal dollars. And if they are listed, say, as a contractor, receiving those dollars through their programs, whether it be some infant mortality program or something that gets those dollars, depending on how long they're shut down, remember, there is no retro pay. So a program like First Step Home, which is for addicted mothers who have there is no retroactive pay. So if the shutdown lasts for a week, 2 weeks, a month, then they will not get dollars retroactive. So any grant dollars that they were entitled to would not come. They will not be retroactive. So that there is an issue. Anybody else? I know most people don't realize that, but there's no, if you're a contractor through those federal programs, there's no retroactive money. We did this the last time when they were the shutdown was threatening, and we dealt with that and actually asked, we had a resolution that said that that those folks should get their dollars retroactive, but they don't.
Thank you, Senator. And just to encourage people again, we still have time, plenty of time to answer any questions or comments that you all may have. And if you don't want to use the Q&A, or if you're not able to, the chat is still also an option. So you're more than welcome to put your questions or comments or concerns in the chat. I had a question for our panelists. So in the beginning, you all were talking about, structural racism versus like an interpersonal level of like bias, and how, when we're having these conversations that, not that we're not focused on the interpersonal, but I guess just more so kind of clarifying or giving a little more background, maybe like historically, on what structural racism is and how it does today impact those factors that you focused on, such as housing or healthcare, just so folks maybe can understand in like that historical context of how it's, continuing today.
Sure. Are you going back to a slide there, Carrie? I have another slide in mind, Carrie, the one from the dashboard slide deck that talks about housing policies.
Yes, I don't have it here, but I know what you're talking about.
I have it up on my screen because I just used it with that other presentation. Do you want me to pull that up?
Yeah, are you able to share?
Let me see. And we have another colleague on the phone, Dr. Tony Oberly is on the whatever webinar. She's trying to link to a brief or send a link to the brief, and it looks like it's only going to hosts and panelists. Can it be sent out to all participants?
I can see your slides, Amy.
All right, great. Do you want to, oh, I'm opening Word too at the same time. All right, I will move that. Do you want to do this one or do you want me to, Carrie?
Yeah, I can walk everyone through. So we use this as an example of structural racism and to explain how that impacts health outcomes in Ohio over time. So we know that there have been decades of policies, including housing policies like redlining, and modern policies like predatory lending, that have contributed to reduced rates of home ownership among Ohioans of color. They've also led to neighborhood segregation, concentrated poverty, and disinvestment over time. Additionally, this has led to concentrated areas of harmful community conditions among communities of color, including things like food deserts, unsafe and unstable housing, which then impact people's ability to be healthy over time. So this is an example of how a policy can influence health. And this is an example of how racism can be built into policies and structures. So again, it's not about individual or interpersonal racism, but about how these things can be built into structures and policies over time.
Mm-hmm. Was that helpful, Daisha?
Yeah, I definitely think that was helpful just to, not just for me, but I guess just for the folks on the call, especially just in case maybe, because obviously when we start talking about that, some folks, there's the conversation of, well, I'm not, mean towards this person or XYZ, whereas like, it's not necessarily about you as an individual, but more so seeing how policies from 50, 60 years ago that might not even be current policy anymore still have kind of that lingering impact. And I guess just reiterating the importance of what policies could be introduced or done now to, reduce and, mitigate like those impacts from many years ago.
Right.
And I just,
Go ahead.
okay, thanks, starting to jump in. I kind of want to change the topic a little bit and ask about whether or not there is research or information that your organization has as it relates to my issue about the environmental impact upon, communities of color and its effect on families and children, babies, and especially because all these things are part of the pathology that prevents, us having healthy babies and families. But I keep wondering about it is the environmental aspect of the air, the water, the other things are causing, another factor that we're somewhat overlooking.
Absolutely. And we are so glad that you asked, because that is a new area of work that we are diving into as an organization. Good. So we just released our first brief in this area on the impacts of air quality on health, and found that, again, the same sort of structural inequities that we see in housing, we're seeing in air quality, where communities of color in Ohio are disproportionately affected by poor outdoor and indoor air quality, which leads to disparities in health outcomes over time. Right. We are right now working on a similar brief related to water quality in Ohio, which we'll be releasing. Is that later this year, Amy, or next year?
I think it's early next year.
Early next year. So we will have that information for you all shortly. We'll be more than glad to share that, but that is absolutely the data and information that we're seeing in the research.
Yeah, that's great because there is on the while you're in the health side of it, on the environmental side, water quality, air quality, and those other factors are, you know, I knew about them, but really I'm now seeing that there is research that is really directly tying those impacts on our health. And that might be part of the reason why we can't seem to, you know, there's so many things wrong with how we're doing things, as Senator Ingram was talking about earlier, the historical facts that we need to work on, but it's like there's so many different facets. Where do you focus your time on?
Right.
And Senator, you're going to say something when I interrupted you, so I'm going to go on mute.
No, I actually was just gonna, when you start to talk about the environment, I'm gonna touch on that. If we start and think about where power plants were built, where people live and where they build housing, where all of that is. And right now, as simple as it seems, our roadways, our highways, which create all of that air pollution, are right through some of our communities and continue to go through some of our communities without any thought about what difference that makes. It's the buses go up and down your street, but they don't get to go through their other neighborhoods. So those are issues that are kind of pushed to the side, but it's been a very long time. If you look at before they closed down some of the housing that was by railroad tracks in 63, that there used to be that many people of color of those communities were there in those areas. So despite the fact that 63 might seem a long time ago when they disallowed some of those shanty houses being built, the impact of the environment and breathing in those chemicals and all of that still are impacting some folks who are just now 70, 85 years old. So we have to look at not repeating some of that. So how far away wind farms? I mean, it seems like, oh, well, that shouldn't make any difference. A wind farm is a solar farm. How close should it be? And in what areas should it be that the impact of that environmentally is actually negative? And if we continue to only put those areas in places that negatively impact poor and minority. And when I say poor, that's what's happening right now in some of those rural areas. So we have to be very careful about that. The environmental piece is huge, I think. But
yeah,
go ahead.
Yes, agree again about all of those statements. Wanted to also mention that there are many opportunities in this arena, many evidence-informed strategies that we could implement to address this as well. One, and this kind of goes back to the analysis that Carrie described before, while completely eradicating all racial and ethnic disparities would result in that $79 billion per year of additional economic activity by 2050, even small things, even doing incremental things over time will make a difference. So, one evidence-informed strategy that improves both health, but also mental health is access to parks and green space. And going back to your comments about where manufacturing was located and how communities were developed, there are areas all across Ohio that are tree deserts, like where there is not enough tree canopy, and that impacts outdoor air quality. It also impacts mental health and well-being. And there are organizations that are doing something about that, providing free trees to people in the neighborhood. I have personally volunteered for one here in Columbus, and it is just so fun to see people coming by to get their trees, and just like their faces lit up with joy because they're so excited to plant a tree in their yard and contribute to the tree canopy. So, I mean, that's just a small thing. Funding those kind of programs would be wonderful, but it's also something we can do individually too. And then, of course, there's broader structural changes we can make in terms of how we create communities and plan communities, which I am going to just see if Tony has anything to add to that, because she just finished her PhD in city and regional planning. This is her area of expertise. So Tony, do you have anything you want to add?
Thanks, Amy. Yeah, I mean, I was so excited to hear that this conversation came up. Thank you so much, Senator Hicks Hudson, for bringing up that intersection of the environment and our maternal child health outcomes. I agree with everything that's been said. Water, air, I mean, all of it ties together, right? Our housing, our food, our transportation, it's all part of our environment. Something else that I was thinking about is urban heat islands, and that ties in with our tree canopy, but also all of the like parking lots and cement that we have in certain communities, like makes those areas just hotter, right? And we know that heat is it's getting worse, right? Our earth is getting hotter, and it's concentrated in communities that are already the most impacted by these maternal child health outcomes. Things like heat stroke. I mean, if I haven't been pregnant, but we know that pregnancy is it's vulnerable time. You're more susceptible to things like exposure to heat. Extreme heat makes people more irritable. It exposes you to things like a higher chance of intimate partner violence, which we already know is a contributor to maternal mortality. So just thinking holistically about these things is so important. And yeah, I'm really excited that we can continue to do work on this intersection, and very happy to continue to discuss it.
I'm glad to hear that. Even though I gave thumbs up, I just wanted to say, because it is something that we know has the effect, but we are not, talking about it in a sense where that we need to, again, make those policy discussions, or even to explore what it is. And so I look forward to having further conversations with you, because going back to Dorian's question about what to look for in the legislature, I'm beginning to start exploring that and seeing what's out there and what we need to do, and then start driving that particular discussion as well, because it is, we have to. So
Right.
thank you.
Thank you. And I will just add I have seen movement in this intersection more in the like Black reproductive justice organization spaces, which I am tied into. So there is movement there, and it's exciting that it's starting to come maybe from the grassroots up to like a state level.
And I would love to hear from you folks in regard to, let's just look at bills that we think don't impact those whole conversations on just the environmental side, not let alone the budget that has all of that other stuff in it, and Medicaid, and I won't get detailed, but Senate Bill 83, which talks about what's conversations are happening on our public college campuses. And one of them is that controversial issues such as climate change will not be discussed. Well, how does that happen? And then allow us to address what that actually means and how that's impacting, especially certain groups of people. So those are things and arguments that need to be brought up about certain bills like that people don't think anything of, because it's like, well, climate change is controversial, so we're going to make it so that the public institutions can't discuss it. Well, that's ludicrous, because to your point, then we are not looking at how certain groups of people are impacted negatively for that very reason. So thank you. That another reason to fight against that. So Deja, is there anybody else, or is there anybody on the line that wants to make a comment? I don't know if, because I'm not the host, is there anybody on the line that wants to make a comment? Can we let them in to speak, or do they still have to just put everything in the chat?
So I want to say that, so you still would have to put it in the chat. So even though it's a Q&A section, I mean, if you do have just a comment that you want to, share with the group, you're more than welcome to do that. It doesn't have to be a question. And then our comms person just said that if you're in the audience, you can use the raise hand function. So I think it should just be right on your screen that there's a little hand that you can raise. You click that, and then our comms person can allow you to speak. So if you would like to utilize that, please feel free. And then I guess we'll let Casey see if there's anyone that has a raised hand. And then if not, then that could conclude our meeting. But I'll give Casey a moment to see if anyone has their hand raised in the audience.
Yeah, I would love to hear from Dorian if he has a comment about the question that he asked, because I get it, it's not, oh, are we doing the same stuff and hearing the same stuff? As to additional thoughts about where we are and what legislation needs to happen, especially in the space of Black maternal health, which is why we're here. And other things here again, Senator Hicks Hudson talked about the accountability piece. What does that look like? Is there something else we need to say back to the governor and the legislature about how that accountability should be noted and monitored and documented? Anybody can respond if they raise their hand.
Well, I'm going to say going once, going twice, going 3 times. This has been a very enlightening discussion this afternoon. I don't know what time it is. And it's just so important for us to continue to have opportunities for folks who are in the field to do that. And I'm just hoping that we will continue on in this way. And I'm going to let Senator Ingram, since she opened up, to finish. So I want to thank everyone.
All the more reason for you to close is because I already did my 2 cents. I just want to make sure folks know that we're here trying to simply do the right thing as far as policies.
Absolutely.
And ours is that umbrella kind of conversation that we need to have. So I think that Senator and I and some other folks, I know that Representative Holmes, who was the chair of JMOC, the Joint Medicaid Oversight Committee, is very interested in what happens in this space. And so those ought to be some of the conversations that we have moving forward. So up to you, Senator.
Well, and I just want to say thank you to everyone that was on the call or the webinar, and also for the presenters. And I am really excited that we go forward and what we do, as Senator Ingram says, is that we do an informed policy, not something that we think of, that it's really something that can actually move forward. And I hope everyone has a great rest of the day, and that we'll look forward to seeing everyone next month. Same time, same place. So take care. Bye.
Thank you.
Thank you. Thank you, Deja.
Thank
Thank
you.
you, team.
Thank you, everyone.
Thank you, panel. Thanks, you guys. We'll be talking, of course.
All right. Wonderful. Thank you for your
Thank you all.
leadership.
Thank you.
Bye.